Immediate dentures are dentures, or we can say complete dentures that are given to patients immediately after extraction of their teeth. So the process of construction of immediate dentures actually starts even before extraction of the teeth. The patient who comes to you, we need to examine properly, and if they are indicated for complete dentures and they wish to have mouth without teeth, that is, they don't want to spend a day without teeth, so we have to give immediate dentures. So we'll see the procedure of making those immediate dentures. Okay, what are immediate dentures? As I told you, they are immediately given after the extraction of teeth. So the first thing to do is the proper diagnosis, and then you need to evaluate whether the patient is fit for immediate dentures. So who are all indicated for immediate dentures? These patients, they are socially active, or they wish to retain their natural appearance with minimum bone loss, and especially they all need to be in very good health. The people with debilitating diseases or who have physical inabilities or motor diseases cannot take them for immediate dentures. Additionally, these patients should have enough time so that they can have multiple visits to the dentist. And what are the contraindications? So these contraindications include either they are financially underprivileged or they wouldn't be available. So they wouldn't have enough time with them to make multiple visits to patients to their clinic. Now, what are the advantages of giving immediate denture? The main advantage is we can maintain occlusal vertical dimension. So we all know after extraction, the, there will be some remodeling of the alveolar bone. But when you give an immediate denture, this alveolar remodeling, though it will take about 1 or 2 months beyond the extraction time, this vertical dimension can still be maintained. After the remodeling of bone, we will lose some amount of vertical dimension. The next advantage is maintaining appearance. And so it will be difficult for outside people who do not know about patient's history of extracting dentures to realize that patient is wearing a denture or patient has lost all his teeth. Another important advantage is we can prevent the tongue spread. So we all know that long-term edentulous patients, they all have problem of tongue spread. That is, the tongue will widen. By making these immediate dentures, we can actually minimize this problem. The next major advantage is hemostasis. This hemostasis, we all know, so when we extract the teeth and after that when we give the dentures, these dentures, they have a pressure on the extraction socket side. So this will help in maintaining hemostasis. Next we come to the fabrication of the denture. The first step in fabrication of the denture is making a proper impression. This impression can be made using any of the elastomeric impression materials, which could be either alginate or silicone materials. So we have to use a proper size stock tray for this impression. Next we go for master impression. Now depending on the type of edentulous, so usually there will be partially edentulous mouth that we will have or that we will be treating. And so if the posterior bilaterally or unilaterally, that is posteriorly there is going to be edentulousness, then you may have to do a special tray followed by border molding. So once this border molding is done so that we can cover the entire sulcus there or even the postpalatal area. Even if there's anterior teeth missing, we can also, in the anterior space also, we can do some border molding. So once this is done, once the border molding is done, then we do the impression using pickup impression technique. How does this pickup impression technique? So once we do the border molding, and then we use your silicone impression material to make the impression of the edentulous area. But of the dentulous teeth or the dentulous areas, we record it with the alginate, with the stock tray. So this is called the pickup impression. So when you take a stock tray loaded with alginate, and then you make the impression over the special tray, which has the impression of your edentulous areas. So after this, you have to pour the model. The next step will be making the bite registration. The patient already has few posterior teeth, that is both maxillary and mandibular. Then we can make use of the intraocclusal record to record the bite. But in other case where a patient has lost posterior teeth, then we may have to do occlusal trims, just like how we do for partially dentulous mouths or when we are doing removable partial dentures. So once you do the occlusal trims, then you guide the mandible to the centric occlusion, and then you record the bite using conventional technique. So in this case, we have to maintain the correct occlusal vertical dimension. In this picture, you can see how the occlusal trims are used to record the bite of the patient. The next will be making a phase flow transfer. So using this phase flow transfer, you can orient the mandible to the hinge axis of the condyles. And then this will also be useful in orienting the maxillary mandibular models in the articulator. So once this is done, we have to come to the decision of choosing the correct size of teeth, the shape and the size of teeth. So the advantage here is that the patient already has few remaining teeth, which can be taken as a guide for selecting the proper prosthetic teeth. So once this is done, we have to start removing the teeth on the models. So you can the standard method is you can use a VP blade or any other instrument to remove the cervical area of the remaining natural teeth on the model. So from the picture, you can see that some amount of the model is also scraped out. And then over which you make the denture base. So once the denture base is done, then after that, you can set the teeth on the denture base. So this teeth arrangement, we do not have the provision for making trial denture for these patients. So the best way is to knock off all the remaining teeth, and then using the bite previously recorded, we can do the teeth arrangement. But what has to be taken care is how much ever possible, to the extent possible, we can replicate the patient's natural appearance. But if it is aesthetically unpleasing, then we can try to create beautifully aligned teeth. Wax trim, as I said, would not be possible in all the cases. But in case there is posterior teeth missing, then we can try to make a wax trim only for the posterior dentulous areas. So once we determine and we re-verified from the articulator that all the bite and other teeth sitting are right, then we can go ahead with preparing the anterior segment also. So once this is all done, then we can go for extraction of all the teeth. So once extraction of all the teeth is done, again decision has to be done whether suture removal, suture placements need to be placed or not. Here caution should be done that while you're removing the teeth, the buccal plate need to be conserved. So this buccal plate conservation will help them slowing down the resorption rate as well as giving us enough bone support for supporting of the dentures. The last step will be once you process the dentures now, the last step prior to placing the dentures will be disinfection. So once you disinfection is very important because the dentures are going to be in direct contact with blood. So you can disinfect it with either immersing in betadine solution or chlorhexidine followed by exposure to chlorine dioxide gas. The next step would be once you have done the disinfection, the final step would be to give a soft liner for the tissue surface of the denture. This is done so that it will not irritate the sockets of the gingiva. So soft liner can be mixed in the correct ratio and then placed on the tissue surface of the denture and then adapted to the patient's mouth. So once it has hardened a little bit, you can remove from the patient's mouth and remove all the excess from the denture base and give it to the patient. Subsequent to 1 month of healing period, the patient can be recalled. 1 or even 3 months later, we can start the process of making conventional dentures. I hope you'll all be able to make good immediate dentures, and this video would be useful to all of us. Thank you. I hope you're all be able to.